This is John Lauder, host of The Cheap Seats. Thanks for listening to the following broadcast on Public House Media.
Strike three, you're out.
Welcome to another brand new edition of Caught Listening here on the Public House Media Network. Christian Heimel with you, broadcasting as always wherever you get your podcasts, Spreaker.com, Stitcher.com, iHeartRadio, Google and Apple Podcasts as well. And of course, you can find us on publichousemedia.org. Well, we are into July, and I guess we are into the start of, I'm going to call it summer camp. It's not spring training. It is training camp, but I'm going to call it summer camp for Major League Baseball as all teams report on July 1st. You have had a number of players opt out with all of this, but it looks as though we're going to get baseball back here in 2020. It's going to look a little weird. It's not going to be as probably involved as we're used to. Of course, with the cancellation of the minor league baseball season also announced on Tuesday earlier this week. So the big question is, what does baseball look like in the COVID-19 era? And more importantly, at least for me, is can this actually happen? Will this actually work? And so to help us talk about this is Dr. Amir Barzin with North Carolina Health, UNC Health, a family practitioner, and has been helping with the COVID-19 response over there in the Raleigh-Durham triangle. And Doctor, we appreciate the time so much. If you couldn't, and I'm sorry if I didn't get that correct, but if you could just kind of let the folks know exactly what it is that you're doing from a COVID-19 standpoint as well.
Yeah, thank you so much for letting me join. By training, I'm a family medicine physician, and I've been in the Department of Family Medicine here at the University of North Carolina Hospitals and UNC Health for some time, but have been helping establish what we have called diagnostic centers across the Triangle area to assess and patients with symptoms of COVID-19 via large-scale testing, and then also continue to evaluate patients in the area who may have symptoms of COVID-19 and are positive, so that we can help keep them in a confined clinical area and limit possible spread across our system.
And this is interesting for our show because I'm based out of the Piedmont Triad, Central North Carolina. You're over there in the eastern part of the state there. So it's rare that we're in the same state when we're having these conversations on the show. But for you and I, we see the numbers in North Carolina. We see that they've been on the rise over the last month or so. And while they're nowhere near what Houston, what Florida, California, Arizona, and what New York and New Jersey were at the start of this, where do you see, as we sit here at the start of July, the spread of COVID-19, not only in the state of North Carolina, but throughout the United States?
I think that everyone is kind of keeping a close ear to this. It's been interesting to kind of see the dialogue that has occurred last few months. I think at the very beginning of the pandemic, it was new to everyone and information was coming in pretty furious, and people were really paying very close attention to the changes that were coming across, sometimes causing a lot of frustration. You know, I remember back when at the very beginning, it was this discussion at the very beginning of should you wear a mask, should you not wear a mask, do masks help, et cetera. And as we've gotten longer and longer into it, it's been more about, I think that the shift of the conversation has turned into more about states reopen, when to do so, what guidelines are going to follow, how to do it safely, et cetera. At this point, my thoughts and kind of seeing this through the process of what's been happening is that as more states are opening, groups are getting more and more involved in being around each other. We have seen this uptick in the numbers and the percentage of positive cases across the country. And so I think that is a pause and a reason for concern, just making sure that we're trying to do as much as we can to protect one each other. And then also, as we're talking about things like sport coming on, what that could mean to the bigger landscape of the country.
And of course, sports starting to come back here in the month of July, the NBA, NHL, soccer, of course, golf and NASCAR have been back for a few weeks now, and then baseball potentially coming. Baseball is the interesting one, in my opinion. I mean, yes, NASCAR started out only doing it in certain locations. Golf has been traveling a little bit, but NBA and the NHL, they're talking about hub cities. But with baseball and traveling across the country, the way it's currently set up, I mean, that to me is the most concerning part, is that you are going to have travel, and they're restricting it basically to their third of the country. The East is going to play the East, the Central's in the Central, and the West in the West. But where's your biggest concern as you see kind of how Major League Baseball could look when they start up at the end of this month?
Yeah, I think that all of it in terms of sports is going to be the risk that is assumed by players, managers, sporting personnel, et cetera, that are involved in the process versus the benefit of having nationwide sporting events, being on a plane with other people that may have been exposed at some time. There's a risk associated with that. Anytime that you're in congregate living situations, not saying that whenever on the road they're all sleeping in the same hotel room, but they are having meetings that are likely held in larger and smaller rooms that could be multiple people in a smaller room. So I think there are the situations where you want to have a clear plan in place and a clear designation of who personnel that have restricted access to the players, who are the non-essential personnel that may not need as much direct interaction with the players and are even held out of their own team meetings. Those are the questions that I think would help make everyone a little bit safer as we're progressing through this.
Speaking with Dr. Amir Barzin here on Caught Listening. Testing is another big issue. I mean, working in minor leagues baseball, that kind of became a big economic issue with how often and how costly some of these tests were. But for your perspective, how often should players be getting tested? And especially if you are, on the road, if they're going to be going out to to restaurants or meeting with their family, whatever it is. I mean, how often can testing realistically and should testing realistically take place in this?
The part about testing is that it's a really tough distinction to know what is truly a, quote unquote, asymptomatic person. And when I say that, I mean someone who doesn't show any signs of symptoms,
right,
being tested, and then possibly what we call pre-symptomatic. Maybe at the time of testing, they didn't have symptoms, but then a day or two later, they started having a cough, shortness of breath, et cetera.
Mm-hmm.
I think that the tough part when you're thinking of sporting events, just look at, for example, a lot of news and talk about how many of their players have tested. The issue with a test is it's like a picture in time. So it's a snapshot of what's occurring at that one. So even if you have a negative test at one day, if you were to, let's say, 2 days in a cough as a team physician or as a clinician that's providing advice for that team, I would recommend that that person be treated. And so I think what we're trying to do is develop an understanding of how frequent that is. A 2-week quarantine or a two-week isolation, 10 to 14-day isolation period for those two tests. For people who are in sporting events, is that too long to wait? If I'm playing a contact sport, football, do I need to be tested more frequently? I would hope that in terms of baseball, there's enough ability to separate during practices and miss out on the direct contact. But, thinking about it, a once a week schedule might be something that the MLB is going to look forward to, traveling to density areas that may be a little bit higher risk, that frequency or cadence of testing increase. But I do think that one of the things that probably is going to fall out of this is that at any point, if there's anyone who has symptoms, that they fall into the line, even if it's outside the normal timeline for testing.
It's certainly going to be interesting to see how this all plays out, especially with the amount of tests that were popping up prior to players reporting, obviously down there in Florida as well. And then you have the concerns of New York teams traveling to Florida and then traveling to D.C. and then Philadelphia or Atlanta, whatever it is, and the concerns of contamination across state lines being a big concern about this as well. I don't even know, there's parts of this game that so many people hold tight to the traditions of it, and it seems as though health and safety should become paramount, should be at the forefront, but somehow the way the game is played may not. So, for example, when you talk about wearing masks in a dugout or social distancing in a bullpen and in a dugout, it's going to be very difficult for players to do that. Chewing seeds or gum or tobacco and spitting, and this is, from what we've seen, is an airborne virus. I mean, the general, not to mention a pitcher licks his finger, touches the baseball, it rolls over to the shortstop, who then throws it to the second baseman, who then throws it to the first baseman. There's so much about this that is, when you think about it, germaphobes probably have a heart attack when you think about baseball. But
yeah,
the actual playing of this game, I mean, how much does it lend itself to the spread of the virus?
So I think some of that we have taken for granted for a long time in the traditions of baseball, we might, do you really need a dugout that has a bench there? Can we have just a few of our players that are in the dugout that may be the reserves that need to be put in? Or do we have our teammates basically spread out across the stadium in different areas, and as they need to be called in for a pinch hit, if there's someone who has a pinch runner, we allow a little bit more time for that substitution than what we normally are used to. Same thing, pens. Bullpens, I think, are probably a little bit of an easier setup because of a little bit larger area with less people, so that you could work on trying to see about how many of our pitchers and catchers and staff that's helping out there we can out a little bit better. But I agree with you, things that we take for granted, someone that is ball, licks their fingers, throws the ball, someone else. Those points are probably going to be very difficult to control in terms of the game. Would recommend there is that as you are coming off the field, be some kind of a procedure that the MLB puts in place where everyone removes their gloves, uses a hand sanitizer between innings, and then goes back onto the field. I think that we're going to try new things that may develop that we're just not used to. Usage of masks on the when people are sitting in the dugout might be another one, or when they're in the bullpen. Things that we're just not used to seeing in baseball that we are probably going to try to implement to try to keep everyone safe.
And then not to mention, obviously, arguments are going to pop up. Coaches or players are going to be in the face of one another, in the face of the umpire, whatever that might be.
Right.
Showers potentially being used. I know there have been talks about clubhouses would not be used at all. No showers would be allowed, the community showers in the locker rooms and things like that. I mean, there's just so much about this that is concerning, and yet there is something that I'm sure a lot of people will put on the other side, but of baseball's played for the majority. There are a few ballparks that are indoors, but for the majority it's played outdoors in the heat, and we have heard constantly, and while the numbers may not show it, we have heard constantly that in the heat of the summer, it may lessen the spread. Is there a benefit to playing baseball outdoors? I mean, is there any credence to that, any evidence that shows that in the heat, in outdoors, the spread is maybe, I don't want to say, I guess lessened is really the only word.
Yeah, I mean, there's a good question there, and I would actually equate it to not necessarily the actual physical temperature of what's going on, but the idea of being outdoors. You just imagine if I'm sitting there talking and I'm outdoors, the likelihood of my spread of contagion is probably going to be lifted in the air faster than if I'm sitting in a confined space and I'm coughing with poor air circulation. So I think just the physical nature of being in a large area, you have 90 feet between the bases, and you have your players spread out pretty wide distances. It's not like you're on an offensive line where everyone is lined up right next to each other every play for football. And so I think that baseball does have some unique ability to be poised to do well. I think what I worry about, and the thing that gives me a little bit of a pause, is what do you do on your roster if one person gets sick and then that transmits to 5 people? What if that takes out a whole starting rotation? Then what are you going to do? Is the game worth that playing through for 14 days without a starting pitcher, and you're bringing in people who are used to throwing 3-4 minute innings in relief or a closer? And then are we doing more harm for the players in the long run then? And so I think that these are the points that I think make it a really, really tough decision. I think that all athletic events and athletic directors, athletic supervisors for team physicians, anyone that's the commissioner for any league is going to take a look at and say, at what point is the risk harder than the benefit of having a season? And I think that's going to have to be revisited. Just because we're saying this is the start date for the season doesn't mean that this is the only thing that's going to be implemented. If one thing we've learned from this entire process is that things change and we need to be pretty nimble.
100%, especially in the fact that it's highly unlikely. First off, it's almost impossible we're not going to have a single positive test throughout this season. Right. Secondly, it's near impossible, in my opinion, that it's only going to happen to one guy in a locker room, and he's not going to infect other people. So the question, and we've seen Adam Silver, the commissioner of the NBA, has even said it, where he's not afraid to pull the plug if there's a spike within the NBA's bubble that they're trying to put together in Disney. I mean, we've heard Dr. Fauci say that this season Major League Baseball should not go past September, But I mean,
Right.
at what point would you, if you had an ear of Rob Manfred, the commissioner of Major League Baseball, at what point would you advise him on maybe pulling the plug if there is a spike, or what does that spike look like? When does it become too much?
Yeah, I think that once you start getting to the point where there's multiple positive cases, and if that positive case spread is on multiple teams. So, for example, like the case that you're discussing right now or talking about, let's say one team has an isolated one person positive and maybe they spread it to two other individuals, but their entire team isn't taken out. They don't have other exposures. They're still able to play a game without having to bring in reserves that may not have been involved in the training process or at higher risk for injury if you're going to jump from not being used to playing at that level to playing at that level. I think that that's a fine idea to continue the game. But once you start getting to the point where 5, 6, 7, 8, 10 teams have 3 or 4 players out, at what point does that make the game not even as enjoyable of watching if your favorite players are not even able to play the game? And now you're looking as if you're almost putting together makeshift teams from the cohort of people that you have that aren't usually being in the starting roster. I think at that point is where the commissioner would probably say, you know what, this spread is too high. This isn't the way the game is meant to be played. This isn't the way that our teams are meant to be doing the jobs that they're doing. The players aren't enjoying it. I think it's time to call a season. I think that we would see that happen.
Speaking with Amir Barzin here on Caught Listening, discussing baseball in the COVID-19 era. A couple of things I want to bring home and try to really push here, because as someone with a compromised immune system, I've been one of those ones who, even as restrictions have been eased, I'm still not going anywhere. I don't care. It's not worth it for me. But the importance of hand sanitizing, the importance of wearing a mask when outside and when around people that you do not know, I can't stress it enough, but I also don't have a medical degree. So, for you, the importance of those two elements in slowing or even hopefully at some point stopping the spread of this disease.
Yeah, I just can't tell people enough how important these two things are, and then other things as well. So if you just think about normal lines of defense for getting a virus, we start with talking about how important distancing is, because really that's your first line. That's your front line defense here. It's not even getting to the point of where a mask is helpful. It's talking about the fact that if we can try to find ways to adequately space around, stop limiting the spread of contagion, you're doing a good job. But if we can't do those measures, the things that we're talking about, making sure that you're washing your hands on a regular and consistent basis, using hand sanitizers, and of course, very importantly, using masks, that these are the lines of defense that we have to be able to go out there and make sure that disease spread stops. I think of it as an interesting caveat. A lot of times in medicine, we talk about the way that medications and pharmaceuticals help improve disease states. Just playing off of that, one of the things that we know is that some cholesterol medicines, for example, whether or not you believe in taking medications or not, some statins can decrease your bad cholesterol 40 to 60%. And that's a substantial decrease in the risk of patients having heart disease. We have something in front of us, which is wearing a mask, that can sometimes control the spread of the disease by up to 70%. It's not a medication you have to take. It's just wearing a mask to be able to support your face, to make sure that you're doing everything to protect yourself. You're protecting the others that may be around you, because you never know if that person you're talking to has a sick grandmother at home or has a child that's going through chemotherapy. So I think if we can continue to stress that and continue to talk about the importance of the good for the general society, I think we start to learn and understand why it makes a big difference. I highlight, last point here on that, but I highlight the fact that countries that were not looking very good at the very beginning of this. A lot of our countries in Asia, for example, Japan, that wasn't looking like they were doing very well at the very beginning, has had probably close to 90% to 100% mask compliance, and they have done a great job of limiting the spread of contagion because of that. Now, it may not be the only reason why they're doing a good job in rebounding and recovering, but it's one thing that I think is low risk enough that we would encourage everyone to do it. Now, granted, if you have a medical disease that really limits it, let's say you have severe asthma and you can't have a facial covering because it limits your ability to breathe. I understand, but I think for the general public, we would really want people to wear masks.
Obviously, we're hoping and waiting for this spread, but I think more people are just kind of, I think the general consensus is let's just wait for a vaccine and see what happens. Obviously, there are so many factors that come along with that, but from what is going on in the medical community and what you are seeing with some of your colleagues, how close are we to a vaccine, and how likely is it that we have one, let's say, prior to next baseball season?
Yeah, this has been one of the most fascinating times to be involved in medicine. I know that I will probably ever see in my entire career. It's been very, very interesting to see how fast the resources that are going into vaccine development, and then also resources that are going into the safety assessment, people willing to volunteer to be involved in vaccine trials. I've never seen anything like this for any other disease. And so I am hopeful, and Dr. Fauci has said this, that we could potentially be getting vaccines off the ground late this year, early next year. The important thing about vaccines, though, is that the vaccine is only as good as its uptake in the community as well. So if we start getting to the point where only 10% of our community is going to use the vaccine, or 20% of the community uses the vaccine, it's going to take longer and longer for us to develop that long course immunity that we need. So my hope is that we have a vaccine that's safe, that's efficacious for us to be able to use by the end of this year, early next year. But we will likely see some kind of a pattern, maybe potentially like the flu vaccine, where you have to take it annually for the first little bit, while more long-term development is being monitored and sought out. But I do hope that by the end of this year, early next year, we'll have some opportunity on the table for people to be vaccinated.
Let's talk with Amir Barzin here. And last thing I want to ask you, obviously they've said there would be no fans in the stands for baseball this year. I don't even want to ask you if there's a chance we could get to that, where maybe we could have it in the playoffs, because I think we all know that answer. But what steps need to be taken, not just by the general public, but in the medical community, do you think, for us to really, when opening day 2021 hits, to have full stands in baseball stadiums across the country?
Yeah, I think that it's going to be a really interesting thing to watch. I think that as we're learning about getting into larger crowds, I think we have to have some kind of accountability for one another and being able to do so. So I think one of the first things I'm going to say, and trust me, this is coming from a long-time baseball fan. I grew up in the Dallas-Fort Worth area. I've been a Rangers fan my entire life. My father-in-law is a massive Cardinals fan, has been so his entire life. And we talk about baseball all the time, but I just really think that a lot of this is going to be personal responsibility. You know, if I bought tickets to fly to Dallas to go to that Rangers game, and I'm not feeling well, I probably shouldn't go to that game. And that's a decision that I would make for myself, but also hoping that others would make for themselves, for the larger community. I would get used to understanding that as I walk into a stadium, I'm likely going to have a temperature check and a mask on. And I think that's going to become our new norm for the next couple of years, is as we go to larger events, these are the things that we're probably going to adopt and accept as society, as being able to be cautious for one another. So I think it's just being an understanding of the fact that we're doing these things not to exclude people from being able to attend events, not to make it another barrier that makes it difficult to go and see a live sporting event, but really something that's going to be done to hopefully keep people healthy and keep people safe. And I think as a society, if we start understanding that and view that as the benefit of doing so, I think we're in a way better place. So my hope is, trust me, the first chance I get to be able to go out and do so in a safe way, I'm going to go watch a baseball game whenever that time is right. I don't know when it will be, but I hope that it will be sooner than later.
You and I both, and I think a lot of baseball fans as well, just hoping for baseball at some point soon. Dr. Amir Barzin, we certainly appreciate the time. Thank you so much. Please continue to keep up the great work in the medical community and keeping people safe and healthy and getting us back to hopefully normalcy at some point soon. We really do appreciate the time.
Yeah, thank you for letting me talk to you all, and I really appreciate it, and stay safe.
All right, that's Dr. Amir Barzin, family practitioner with UNC Health and also director with their respiratory and disease and making sure people stay safe. And guys, listen, I don't care what you believe politically. I don't care what you believe religiously. I don't care what you believe anything. But if you can't get behind some of the things, as he mentioned, 70% studies have shown that wearing a mask can help reduce this stuff and help get us back to playing baseball and get us back to normal. That's something that's easily able to be done. So hopefully we're able to do that. And I'll be honest with you guys, as much as I want baseball, and I know I said a couple weeks ago, if you really want to show Major League Baseball and the Players Association that you're done with the games they were playing, trying to get this season going, that you tell them, you're not going to go. I can't wait for baseball, but I'm also very concerned that we're not going to finish this season because of a potential COVID-19 outbreak within somewhere in these stadiums and potentially back in to the community as well. There's a lot to get discovered. There's a lot to get touched on and get wrapped up. I hope you guys had a good listen to this. I hope it helped in any way, shape, or form. We'll get back to regular baseball stuff and some other things going on, but I wanted to bring that attention because I don't think it's being talked about enough, and I don't think it's being taken seriously enough as we try to get back to normalcy. Hopefully we can do that, and we'll try to do that next week on Caught Listening. For now, subscribe, rate, review, share us with your friends and family on Twitter, Instagram, and Facebook. Just search Caught Listening by Public House Media. I'm Christian Heimel. We'll talk to you next week. You have been Caught Listening.